We have the peanut gallery to my right. So with that being said, Ryan Kennedy probably will make some kind of comment during this. Just ignore it. Anyway, we're going to start making these kits up for our infusion medication. So here's what the label on it will look like. We're going to use brighter paper eventually, but we're in the first draft phase. So here's what it looks like. So tall man lettering, norepinephrine, Levophed, the other name for it. In the first draft, you'll see up here at the top in red the expiration date for the item that expires first in the kit. And then you'll see the contents of the kit here along with what the expiration date is. These will be vacuum sealed, so you don't have to open it. You don't have to worry about somebody like Ryan stealing the 5 ml syringe because he didn't check his truck and he needs it. If the kit's unsealed, then it needs to be replaced. So anyway, this is what it looks like whenever you open the kit, and this is visible from the inside. You can see it on the outside. When you open this up, it tells you exactly what to do. So how to mix it, what the concentration will be, what IV set to use, and then your doses down here on the table. So 4 mics per mil, you'll do 15 drops, so on and so forth. At the bottom, it shows you how to make the label for it. We probably are never as disciplined as we should be with medication safety. And as we're going into the hospitals, we certainly need to make sure that these are labeled correctly. Sorry about that. Here we go. So inside the kit, what's here? We have 5 ml syringe. We have a straight needle, so just a 20 or 18 gauge needle. We have a filter straw or a filter needle. And then we have a 250 bag. It'll either be normal saline or D5W. You can mix in both. D5 is what's recommended, but doesn't make that much of a difference. We got a 60 drop set. And then the card itself, which is the label on one side as far as the outside of the bag and the contents with expiration, and then the mixing instructions and the dose on the other. Also in there is a couple of blank labels so that you can get it done yourself, and you can get it labeled. Give me the pen, Ryan. Thanks, Chris. Not Ryan. Anyway, and you'll need a pen. Not provided in the kit. So let's mix this up. So we're going to put the NorEpi inside the barrel of a 10 ml syringe. So we just took the plunger out, put the NorEpi in there. That's how we're going to be able to squeeze this without breaking it. There'll be a little piece of tape over the top, but that's the only point to this thing. So you'll dump out your NorEpi in your hand. Here it is. Shake her down. And you got that. Let's set that right there. Let's get our 5 ml syringe open. And let's open our filter straw. And so one time you may have a filter straw, the next time you may have a needle, depending on what's there. Remember, when you break these ampules, always do it into 4x4 or something, break them away from you, and then that goes in the sharps box. So now that we have this open, do not inject any air into an ampule unless you want to mess on your hands. So now you'll just withdraw, get it all out of there. Come on, we're done. All right, perfect. So draw back just a little bit more to make sure that your filter straw is empty. Put on your straight needle. Find your bag. So this one's already spiked just because it's a demo and I've already mixed in it. But what you would normally do is have a blue end on this. This will be completely covered. And then this is a vial port is what it looks like. This is your injection or your additive port. So this is where you'll add your drugs to. Do not spike your bag until your mix is mixed, because if you do that, anything that's in this tube doesn't have any drug in it, and it's kind of going to throw off your math. When is this primed? How much tubing does it, or medication or mils of fluid does it take to prime this tube? Just don't get into that. Just wait. Just switch your steps. Fill first, prime second. So now we're going to flip this over here. Don't do that, it's bad. So go into here, wipe your port off. Of course, we would all do that kind of stuff. Don't stick yourself in the hand, inject it. With Levophed, you don't have to worry about it foaming like you do with amiodarone or anything, so you can just put it right in. Then you just give it a little shake, spike it. Now you have your drip set here going. And let me get the glare right. You should be able to prime your set and then start running your Levophed. Remember, with 60 drop sets, sometimes it's easier to open to full run and then come back to your dose. So let me look at that list. 4 mics is 15 drops a minute. So there's 60 seconds in a minute. So 60 divided by 15 is 4, 1 drop every 4 seconds. So I'm going to go to pretty open, and then I'm going to back up. That's going to be a hard 1, 2, 3. Nope. Try it again. 1, 2, 3, 4. Go up a little more. 1, 2, 3. Almost there. 1, 2, 3, 4. That's where I'm leaving it at right there. This is not exact, so if you're off by half a second, don't worry about it. The more common dose we'll start at probably is 8. So with 8, that's going to be 30 mils. So that's going to be 1 drop every other second. That's a little bit easier to manage. So it's going to be, there's 1, 2, 3, 4, 5. Anyway, maybe not counting that fast, but that's it. That's all the LevaFed that you got to do. So now we're going to label it now that we got the patient going on it. And we're going to write Levo or NorEpi. We're going to put the weight of the drug, which is 4 milligrams. We're going to put the volume of the drug, which is now the bag, 250 mils. So it is 254 mils, or you don't get crazy with it. 250 mils. We're going to put the date on here, the time, and your initials. Just take that label, and they're all different colors, but they're bright, so you can see it, and just slap it on the front of the bag, and now we are in compliance. As much as we have to be. So if you have any questions, let me know. Those Levo kits should start coming out pretty soon. We're going to make several of them up, send them out, and then collect the stuff off the trucks to keep making more. Anyway, if you have any questions or comments, let me know.